Pneumonia is a common yet potentially severe health condition that significantly impacts global health, particularly the vulnerable population. It is characterized by inflammation of the lungs air sacs, leading to difficulty breathing and persistent cough. It is caused by various pathogens like bacteria, virus, fungi, and in some cases, aspiration of foreign substances into the lungs. Understanding the role of nutrition in the treatment and prevention of pneumonia not only aids in recovery but also improves long-term health outcome. In this video, we talk about the root cause, the severity, the treatment, prevention, and the overall nutritional requirements. So sit up and let's get started. Are you new to this channel? This is where your health matters, and my name is Elizabeth. You are welcome. In this channel, we give you tips on how to take care of your health, all the necessary healthy tips I need, especially the nutritional tips needed for your health. Pneumonia is a respiratory infection that inflames the air sacs in one or both lungs, which may fill with pus or fluid. It is caused by bacteria, virus, fungi, and also in some cases aspiration of foreign substances into the lungs. Pneumonia is called bilateral or double pneumonia when it affects both lungs, and it can range from mild to severe and is potentially life-threatening, especially for infants, the elderly, and people with weakened immune system. The severity of pneumonia depends on the root cause. Bacterial pneumonia tends to be more severe and common than virus pneumonia, which is more likely to require a hospital stay. If it's caused by bacteria, it's more likely you will have to stay in the hospital for treatment. But if it's virus, it can go on its own. You don't really need to stay at the hospital. Pneumonia is classified based on the root cause. If it's caused by bacteria, it is called bacterial pneumonia. If it's caused by virus, it is called viral pneumonia. And if it's caused by fungi, it is called fungal pneumonia. General symptoms of pneumonia: we have coughing. When you cough, especially if it's dry cough, it is called by virus pneumonia. Headache, muscle pain, extreme tiredness or weakness, fever, chills, sweating, shortness of breath, chest pain, especially during breathing or coughing, confusion in older adults, bluish skin, nails or lips, loss of appetite, pale skin, restlessness, grunt sound with breathing or noisy breathing, difficulty feeding, crying more than usual for baby, limpness for baby too, general discomfort. Those are the symptoms of pneumonia. What are the risk factors of pneumonia? We have smoking. When you smoke a lot, at risk of developing pneumonia. Pregnant women also can develop pneumonia. Age is a high factor for children under 2 and older adults over 65 years old. Chronic diseases, people that suffer from chronic diseases like asthma, any lungs kind of diseases, diabetes, heart diseases, those with weakened immune system like HIV patients, chemotherapy, someone that is undergoing chemotherapy, they are also at risk of developing pneumonia. Pneumonia can be diagnosed through medical history or physical examination, blood test, sputum culture, chest x-ray, pulse oximetry to measure oxygen level. And it can be treated by antibiotics if the root cause is bacteria. It can be treated by antifungal if its root cause is fungi. It can be treated with antiviral medication if the root cause is virus. And virus pneumonia often go on its own without any medication. Also, rest, hydration, pain reliever, and fever reliever medication can also be used to treat pneumonia. Prevention of pneumonia. To prevent pneumonia, you have to adopt good hygiene. Wash your hands, But like, adopt good hygiene. Make sure you practice good hygiene. You wash your hands whenever you eat or you touch anything. Wash your hands. Make sure you are always clean. Cover your nose when you cough. Cover your mouth when you cough or sneeze. And also avoid smoking. Live a healthy lifestyle. Living a healthy lifestyle strengthens the immune system. Vaccination is also very important in preventing pneumonia. Vaccination like flu vaccines or pneumococcal vaccines. If you leave pneumonia untreated or you are suffering from severe pneumonia, it can lead to complications like lung abscesses or respiratory failure. Or when treating any infection, any diseases, what we eat are very important. In the treatment of pneumonia, we have to consider what we eat. It's not just about getting treatment in the hospital or buying drugs and all. You have to consider what you eat too. Eating healthy also helps to fight off infection. Like our macronutrients, for example, protein are very crucial for tissue repair and immune function. Our proteinous substance, our proteinous food are very important. Our protein sources are like our mini meat, fish, eggs, legumes, dairy products. They are very important in repairing our tissue and our immune and boosting our immune system. Carbohydrates also provide us with the energy we need to fight off the infection. Our carbohydrate sources are whole grains like rice, like yam, a potato. Like, they are very important. They give us the energy that we require for our day-to-day activities and for fighting off the infection. Our fats is also important, especially the healthy fats like our avocados, our nuts and seeds, our olive oil, our fatty fish like salmon, sardine. They are rich in omega-3 fatty acids, so they are very important in fighting off this infection. Our micronutrients like vitamin C. Vitamin C is very essential in boosting our immune system and helps to reduce inflammation. Examples of vitamin C fruits are our oranges, our strawberries, our bell pepper. Yes, our bell pepper, they are very important. Our spinach, our green leafy vegetables, they also help to boost our immune system. Vitamin D supports respiratory health, and sources of vitamin D is sunlight exposure. Early morning sunlight are main source of vitamin D. Our fatty fish, they are also sources of vitamin D. Supplements, that is if your doctor prescribe it for you. Supplements is also good. Supplements like vitamin D supplements are very important. Zinc also promotes healing and immune function. Sources of zinc are meat, are shellfish, are legumes, are seeds. Iron is also important when you're treating pneumonia, as iron supports oxygen transport in the blood. And food source of iron are our red meat, fortified cereals, green leafies, our living grains, our vegetables like spinach. Also, vitamin A helps maintain mucosa surfaces and lung function. Like carrots, sweet potatoes, vegetables, they are rich in vitamin A, so they help to maintain mucous surfaces. Selenium protects oxidative stress. It protects us against oxidative stress. And sources of selenium is our eggs, our fish. They are very important. Being adequately hydrated helps thin mucus and supports overall recovery. For adults should take at least 8 to 10 cups of water daily, while children should adjust according to their age. Their intake of water should be adjusted according to their age. And sources of hydrating sources are water, herbal teas, natural fruit juice, clear broths. They are very important. When suffering from pneumonia, consider frequent meals to prevent fatigue from eating. When you put your food in like you eat in bulkiness, like your food is bulky, you tend to be tired of the food. But when you portion it small, but make sure you eat frequently. Also, soft or blended food for those with difficulty swallowing is very important, and should avoid sugary or processed food. Fried foods can also increase inflammation. Make sure you avoid anything that will increase the inflammation of your lungs, and follow all the prescription your doctors give you. and you see that this thing, all this is not working, make sure you go and see your doctor. Thank you.